This is Midwest Moxie, a show about our region's visionary entrepreneurs and the experiences that shaped them. I'm your host, Kathleen Gallagher, Executive Director of Five Lakes Institute. Chris Fernandez could have continued to grow his t-shirt company, which had more than $50,000 of sales in its first year. But he sold it, got a graduate degree in biomedical engineering at the University of Wisconsin-Madison, and in 2015 co-founded a completely different type of company. EnsoData pioneered the use of AI and machine learning to analyze medical tests like EKGs and pulse oximeters. Today, the Madison Company's products and services help clinicians diagnose and care for patients with sleep disorders. EnsoData has about 70 employees and has raised $50 million of investor funding. Chris, welcome to Midwest Moxie.
Thank you, Kathleen. Thrilled to be here and to have the opportunity to share a little bit about our story.
Thrilled to have you. In the very early days of the company, you had the classic situation many young high-tech startups face. You knew how to deal with these massive data sets. You had the technology down pat, but you didn't have a market to apply it to. How did you land on sleep?
So we landed on sleep through a series of pivots. The first iteration of the technology that we created was a wearable that you could wear on your earlobe with the goal of keeping congestive heart failure patients out of the hospital. When that didn't initially get traction, we pivoted to try to take that wireless technology along with the machine learning cloud to other medical device companies to see if we could upgrade their platforms and bring them into the connected ecosystem that was the Internet of Things. They didn't know what to do with it either. And that taught us that we needed to find a killer application, defined as a big problem that existed at the confluence of machine learning and AI, big data, and important problems in healthcare that we could create and ultimately serve all the way through to an end customer. The last thing that you ever want to be in a startup is a solution looking for a problem, but at the time, that's what we were. We had a big machine learning cloud for medical waveform data, and we needed to find something to work on with it.
So I just want to say medical waveform data, that's like when you think of an EKG chart or brain waves or heartbeats, that's the data. You knew how to collect all that data and analyze it, and that's a lot of data. You were at the cutting edge of that.
We were the nerds that were doing data science competitions in undergrad and grad school. We just fell in love with machine learning and AI. A lot was happening with images and text data that's, turned into what we now have as GPT. But it felt like there was a lot less work happening at this important intersection of waveform data. And we saw the opportunity to try to design deep neural networks and deep learning approaches that could specifically take advantage of this unique data and bring greater insights to healthcare providers than they've been able to get in the past from this valuable data.
But you were getting your master's degree. One of your co-founders was driving an Uber, right, to get money for all the cloud storage you needed. You were young.
Yeah, cloud computing is very expensive. Running these data sets through models is very expensive, and it also takes a lot of time. So we would submit models. They would take a few hours. He got a few Uber runs in the meantime, and that helped to fund our servers, in the early days. After interviewing clinicians from about 100 different medical specialties, everyone conceivable, hematology, hepatology, endocrinology, neurosurgery, cardiology, we, through a stroke of luck, found the world of sleep and sleep medicine. And the more we dug into it, it felt like a conspiracy. We learned that of the world's population, nearly 1 billion people have sleep apnea, more than 60 million in the United States. And today there are 80 to 90% undiagnosed and untreated. So we think about opportunities where we need to increase access to care, make the care pathway and care delivery more efficient. It seemed like one of the most incredible places to be able to apply machine learning technology to try to make this care pathway more efficient and allow it to reach more patients to tackle this huge, huge unmet need.
One of the things that really helped you when you were starting out, when you had this technology and you were looking for a problem, you went through one of Generator's G beta classes. And how did that help and where did you go next?
Yeah, we say Generator G beta, transformed us from ordinary engineers into formidable startup founders. There's just a lot of lingo and best practices. They don't teach you at school. They don't teach you at big companies. And I think startup accelerators are a really unique educational platform to try to accelerate your way through that knowledge, get really good advisors and mentors, and ultimately set you on a path where you can leave a full-time job, you can leave college, and you can start to work on your company full-time. G-Beta allowed us to do that, and ultimately ended with us getting to, or getting encouraged to, forced to, by the very thoughtful advisors there, apply to the Y Combinator program in California. And we got to be one of 35 companies out of 7,500 that applied, packed up the car, and drove to California from there.
Y Combinator being one of the premier, probably the premier accelerator in the country. So you went through that, learned more of the kind of things you had learned at Generator. And then there you were in Silicon Valley with one of these leading edge AI technologies, and you couldn't raise any money. Why not?
I think that sleep has kind of gone through a little bit of a paradigm shift over the last decade. A decade ago, people were still bragging about not sleeping. And with the proliferation of wearables, with book like Matt Walker's Why We Sleep, Ariana Huffington's book on sleep, and more, we've almost gone 180 degrees to bragging about our sleep scores and how good, we're doing it. I think people have increasingly realized that sleep is the third leg of the stool, along with diet and exercise. It plays a major role in our health and wellness. And we think about chronic conditions like high blood pressure, like diabetes, like obesity, depression, even neurodegenerative disease, cardiovascular disease, and more. Undiagnosed sleep apnea is consistently at the scene of the crime in, exacerbating those other conditions and leading to poorer outcomes, across the board. And so I think that we knew that we were onto a big market opportunity, but it was early in the broader, public perception about how important sleep was.
So what you're saying is sleep was underrated in Silicon Valley, and you had to come back to the Midwest to raise the money.
Indeed.
So I went and I started looking at, I had heard about these sleep studies, but I went and started looking at it, and, an in-clinic going and sleeping there overnight sleep study, or a polysomnogram, uses at least 22 wires that are connected to sensors on all these body parts, including your legs. Then if you're diagnosed with sleep apnea, you have to sleep with a CPAP machine that pumps pressurized air into a mask that covers your nose or face. I mean, it sounds crazy, but talk about wind at your back. Things are changing. Can you tell us about how?
Yeah, sleep medicine has undergone a transformation, truly transformative changes in the last 12 months. Earlier last year, we obtained our fourth FDA clearance for AI and machine learning software to aid in diagnosis for sleep disorders. The first version, automated analysis for those very complex tests that you mentioned. The second version, expanded access for home sleep testing with traditional home testing devices, which are still a bit complicated, involving 3 electrocardiogram leads, 2 airflow leads, 2 respiratory effort belts, and more.
Yikes.
Last year, we enabled that full sleep study and all of its diagnostic outputs and information to become standardly available from simple wearables. We only need one sensor now, and that's the pulse oximeter, the PPG. That is the most ubiquitous and universal sensor that's available in smart rings, smart watches, lots of different kinds of patches, bedside monitors, and more. And so what we've done is allowed this very complex test to now be done in a very patient-friendly, comfortable, convenient, low cost, high quality, and very accurate form factor. And that's really transformed the scalability and the economics.
So I can do my sleep study at home now wearing a ring, say.
Yes, that's
and your
correct.
software would analyze it for the clinician. And then these CPAP machines are also being replaced. There are pills now?
Exactly. There's been a tremendous evolution in sleep apnea treatment. In addition to CPAP, oral appliance therapy, neuromodulation implants. Even more recently, GLP-1s, weight loss drugs, were approved late last year for the treatment of sleep apnea. We have the first pill coming to market for the treatment of sleep apnea as well in phase 3 clinical trials. And so this care pathway that used to be as complex as 20 sensor polysomnography and CPAPs just got to be as simple as wearables and pills. And I think for a lot of people that knew that they might have sleep apnea, maybe they've gotten a lot of elbows from a bed partner about snoring and have been avoiding the care pathway because they thought it would be inconvenient and very onerous, is bringing people out of the woodwork, getting people a lot more interested in addressing their sleep problem.
Once you landed on sleep, You brought your first product, EnsoSleep, to market just 2 years after you started the company. It was a complicated product. How did you do that so quickly?
Yeah. In the early stages, it's all about finding product market fit. And there's two major techniques to doing that. One is go talk to your users. If you're not writing code or developing a product of another variety, you should be out there talking to your users, understanding the problem, and trying to create a solution that addresses that. The other aspect is iteration. Build, measure, and learn. Talk to your users, then pivot or persevere. Before you have any traction, before you have any users, the cost of pivoting is zero because you don't have anything that you're pivoting out of yet. So you pivot as many times as you can, as quickly as you can, until it's working. And you know it's working when it's working, as they say. So it's just about iterating. It's about delivering an 80% solution quickly rather than taking a longer time trying to get a perfect solution. It's about getting out there and learning. We called every single sleep clinic in the Midwest. We drove to every single sleep clinic in the state of California. And that's the kind of effort you need to apply to find your first handful of early adopters. But with the right early adopters and the right iteration, you can get to product market fit that quickly and get through the FDA with a small team and limited experience.
Talk about right place, right time. But what makes your technology better than like a smartwatch or a wearable that, from Apple or Samsung?
I think that there's a couple of things that make us unique. In 2017, we obtained, the first FDA clearance for AI and machine learning software in the field of sleep medicine. And that sort of started a data flywheel effect, if you will, where we would deploy to another customer that would collect more data, that would improve the product, that would make it easier and faster to get the next customer. And after repeating that cycle, many times, we've created what we believe is the largest sleep waveform database in the world of this complex polysomnography data. Nearly 5 million sleep studies, thousands of terabytes, more than a petabyte of data. And this gives us the unique ability to look at what's happening in this pulse ox, this PPG, simultaneously and in relation to what's happening in other parts of the body. We can dial into specific, consistent, and strongly associated patterns in the PPG that tell us if a patient is in stage REM of sleep or slow wave sleep, having an apnea event, and more. And so through this really unique data set, I think we've been able to create what amounts to the most accurate way to measure sleep that's been created so far from this single channel, single sensor test. Other companies may have a higher volume of PPG data, but without that simultaneous brain data, heart data, airflow data, and more, it can be very hard from a machine learning and AI training standpoint to dial into that same millisecond to millisecond degree of specificity and being able to tell what all else is happening throughout the rest of the body.
EnsoData is growing very rapidly. When we talk, you had to do some checking to figure out your number of employees because you're hiring so quickly. What kind of potential does your company have?
We think in the next 10 to 30 years, AI and machine learning will be used to support every diagnosis and treatment decision that's made globally. Today, it's still a small minority of cases. So with 1 billion people with sleep apnea, 80 to 90% undiagnosed and untreated, with the state of US and global AI adoption in healthcare being where it is, we've got 99% of the growth opportunity, still out there ahead of us. And we're incredibly excited to be able to pursue that and help reach the other 80% of undiagnosed patients to help them sleep better. The question still stands, are we a one-trick pony, or is there more that we can apply this technology to beyond sleep apnea specifically? And we have dreams and ambitions of solving multiple important problems in cardiology, neurology, and more to try to further expand the patient access impact that we can make. So I think it could be quite big, and time will tell, just how far we can go.
Wow, what a story. And what an amazing thing that the Midwest saw the potential of it before Silicon Valley. Thank you so much for sharing that story, Chris.
Oh, of course, of course.
You can read more about today's guest by visiting WUWM.com. Don't forget, you can also listen to the show as a podcast if you'd like to take us on the go. Just search for Midwest Moxie, that's MOXIE, wherever you listen to your podcasts. I'm your host, Kathleen Gallagher. Midwest Moxie was created by executive producer Audrey Nowakowski and me. Today's episode was produced by Audrey Nowakowski and engineered by WUWM's Jason Reevy. Join us next Saturday afternoon at 2:30 to hear from more visionary Midwestern founders building innovative companies. That's right here on 89.7 WUWM, Milwaukee's NPR. Support for Midwest Moxie comes from Microsoft, whose efforts to drive technology development across the Midwest and beyond include its National TechSpark community engagement work, which started in Wisconsin, its role as co-founder of Titletown Tech in Green Bay, and its new AI co-innovation lab at University of Wisconsin-Milwaukee. More information is available at Microsoft.com. Support also comes from Quarles, a multidisciplinary AM Law 200 firm with approximately 550 attorneys who support large and small businesses, from Fortune 500 companies to startups and entrepreneurs across the country. More at Quarles.com.